Hi, Miss Jones. How are you today?
I'm good.
That's great. Can I see your wristband, please?
Yes,
Can
ma'am.
you verify your name
Sandy Jones,
and your birthday?
12479.
Okay. How are you feeling today?
I'm pretty good, I
Pretty
guess.
good. How's your pain?
Oops, not much.
Can you rate it on a scale from 1 to 10? 10 being the worst?
Probably 2.
A 2? Okay, well that's good. And your doctor, do you know if your doctor ordered you any medications or if you're on any?
Yeah, I took it like an hour ago.
Okay. And are you allergic to anything?
No, ma'am.
You're not? Okay. Well, I was coming here to talk to you about your skin and about your wound and what affects your healing and the signs and symptoms of your infection. Is that okay?
Yeah, can my sister listen to it too?
Yeah, that's fine. Okay. So first, there's 3 layers of your skin. There is your epidermis, your dermis, and your subcutaneous. Your wound is in the dermis. The dermis is located under the epidermis, and it is the largest portion of the skin. Your epidermis is above that,
Okay.
and then your subcutaneous is under the skin, which is way underneath that. The subcutaneous has the well, I've already said it's under the skin. There are some ways that might affect the leg of your skin. There is external and internal. The external is like the friction and the shearing and the forces and the pressure, restorations, medication. There's many more, but I'll list a few just so you can know those two, so you can learn about those.
Okay.
There's also internal, which is like fluid, imbalanced nutrition, impaired circulation, and impaired sensations. Do you have any questions so far?
No, ma'am.
Okay. Is it okay if the nurse comes in and looks at your wound and assesses your wound and treats it and stuff?
Sure, is she gonna teach me how to take care of
Yes,
my
she's going to teach you the proper hygiene and like what you need to do and what to keep it from. She'll come in and talk to you, okay?
Okay.
Hello, Miss Jones. How are you today?
I'm good.
Can you say your name and date of birth?
Yeah, Sandy Jones, 12479.
All right. My name is Destiny, and I'm going to come in and treat your wound and show you just exactly how to take care of that.
Yes,
The
ma'am.
doctor has ordered a wet to dry dressing. He doesn't want to irrigate it this time. Is that all right?
Yes, ma'am.
Okay, just let me go get my supplies. How are you feeling today?
I'm good, I guess.
Do you have any pain?
Tip, level 2 is my pain, so not much.
Okay, I'm going to uncover this leg and take a look at your wound.
Okay.
All right. I'm gonna measure your length, width, and depth of your wound. Alright, now I'm gonna clean your wound. And as I stated before, the doctor just ordered a wet to dry dressing. Alright, I'm gonna go change my look and grab some more supplies. Alright. You may feel a little wetness, I'm gonna pat your wound.
Okay, Ms. Jones, while she's working on your wound and stuff, I'm gonna go ahead and explain to you, like, like the healing process, the signs and symptoms to watch for, and what can slow your healing process. Is that okay?
Yes.
Okay, so first off, whenever you get a wound, it's a puncture that goes through the skin down to the vessels, and this is what causes it to bleed, because it hit a vessel. And after that, then the blood clots, and it becomes into a form. And this is when it comes into a form, it's gonna come up to the skin, and it's gonna like dry into a scab. And that's what causes the scab is to clot. And then the tissue is gonna repair again, and this is when the scar tissue begins. During this time, the surface epithelial cells will begin to multiply and fill the area. And then when the epithelium is complete, the scab forms, and this is the process of wound healing. Do you have any questions?
Yes, how do I take care of it at home?
Okay, I'm gonna explain that to you. So whenever y'all get home, one of the most proper thing you can do is hand hygiene. Always wash your hands before and after, and every chance you get, basically, to keep it from getting infected. Because when it gets infected, that's no good. Some of the things, are you a smoker?
No, ma'am.
Are you a drinker?
No, ma'am.
Okay, that's good, because that's one of the things that slows it down from healing. When you're smoking and drinking, a lot of people that do that don't get their wounds healed, and that's not any good. You gotta have a good nutrition too and a good diet. If you're just eating a bunch of bad stuff, it's not gonna be good. When you have a lack of vitamin C, that's what causes it not to heal. You need lots of vitamin C and vitamin D for it to heal.
Okay.
Let's see. Whenever you're cleaning your wound, make sure you do the proper disposal of the wound. Make sure you wash your hands, throw it away. If you anything that you do, your gloves and stuff, don't touch the outside of your gloves. Put it in a plastic bag.
Okay.
Let's see what else. Do you have any questions so far?
No, ma'am.
You don't? Okay. Well, that's good. Well, do you feel any better after your wound has been redressed?
Yes, ma'am.
What's your pain now?
My pain is, I don't have pain
You
anymore.
don't have any pain at all, so
No,
your wound
ma'am.
is good?
Yes, ma'am.
Okay, so whenever you go home, just make sure you wash your hands, you change it properly, you dispose properly, just things like that to keep it from infected. Also, too, whenever you examine your wound, make sure there's no redness around it, there's no fever in it, there's no pus come out of it, all that kind of stuff, because that's a sign of infection, and you don't want any infection into it. So make sure you keep all your wound good, clean, good hygiene and everything. Their wound should be healed in no time.
Okay,
Alright, thank you.
all right.
All information found in the NANDA, the Basic Skills Book, and the Health Science Book. Have a good day.